What if I told you that something sitting in your medicine cabinet right now, something you've trusted for years, could be quietly increasing your risk of memory loss, confusion, and even rapid cognitive decline? Most seniors worry about genetics, aging, or family history when they think about dementia, but very few realize that certain common, widely prescribed medications may significantly affect how the brain functions over time. And the most alarming part? Many people take these drugs every single day without ever being warned about the long-term cognitive risks. Today, we're going to talk openly and honestly about 9 popular medications that research has linked to memory problems and increased dementia risk in older adults, and more importantly, what you can do about it. As we age, our brains naturally change. Processing speed slows a bit. We may occasionally forget a name or misplace our keys. That's normal aging. Dementia, however, is not normal aging. Dementia involves persistent, worsening decline in memory, reasoning, and daily functioning. And while age is the biggest risk factor, it is not the only one. Medication burden, especially in adults over 60, plays a much bigger role than most people realize. Let's begin with a category of medications known as anticholinergics. These drugs block a chemical messenger in the brain called acetylcholine. Acetylcholine is essential for memory, learning, and attention. When you reduce its activity, you may reduce symptoms like bladder urgency, allergies, or insomnia, but you may also interfere with cognitive clarity. Common examples include certain over-the-counter sleep aids, allergy medications, and drugs used for overactive bladder. Many of these contain ingredients like diphenhydramine, which is widely used and easily accessible. For seniors, long-term use has been associated in multiple studies with increased dementia risk. The brain depends on acetylcholine, especially as we age. Blocking it repeatedly over time can create lasting effects. Now here's where it becomes even more concerning. Many seniors are taking more than one anticholinergic medication at the same time without realizing it. Perhaps an allergy pill during the day and a sleep aid at night. Each one may seem harmless on its own, but together they create what doctors call anticholinergic burden. The higher the burden, the higher the potential risk to cognition. The second category includes certain benzodiazepines. These medications are commonly prescribed for anxiety, sleep problems, or muscle spasms. Drugs like diazepam, lorazepam, and alprazolam can be effective in the short term, but they work by depressing the central nervous system. In older adults, they can cause sedation, confusion, slower thinking, and increased fall risk. Long-term use has been linked in some research to higher rates of cognitive decline. The aging brain metabolizes these medications more slowly, meaning they stay in the system longer and may accumulate. Sleep is important, managing anxiety is important, but long-term reliance on these medications, especially without regular review, may not be the safest strategy for seniors. That's why many geriatric specialists recommend using them cautiously and for the shortest duration possible. Next, let's talk about certain sleep medications often called Z-drugs, such as zolpidem. They are frequently prescribed because they are believed to be safer alternatives to benzodiazepines. However, in older adults, they can still impair memory, increase confusion, and contribute to nighttime disorientation. Some individuals report episodes of sleepwalking or memory gaps. Chronic use may interfere with natural sleep architecture, which is critical for memory consolidation. Deep sleep is when the brain clears waste proteins associated with neurodegenerative diseases. If medications disrupt that process, it may have long-term consequences. Moving on, we need to discuss certain antidepressants, particularly older tricyclic antidepressants. These also have anticholinergic properties. While newer antidepressants tend to have fewer cognitive side effects, older ones can significantly impact mental clarity in seniors. Depression itself can cause memory problems, so treatment is important, but choosing the right medication matters. Not all antidepressants are equal when it comes to cognitive safety in older adults. Another category that surprises many people are certain bladder control medications used for overactive bladder. These drugs reduce bladder spasms by blocking acetylcholine, the same neurotransmitter we mentioned earlier. While they may reduce urgency and leakage, they can also cross into the brain and affect cognition. For someone already at risk for memory issues, this can compound the problem. It's always a balance between symptom relief and long-term brain health. Let's also discuss some antipsychotic medications, which are sometimes prescribed off-label for behavioral symptoms in seniors, especially those with agitation or sleep disturbances. While they may calm certain behaviors, they carry significant risks, including increased stroke risk and cognitive worsening in elderly patients with dementia. These medications are powerful and should be used only when absolutely necessary and under close supervision. Now here's one that many people never expect: certain medications used to treat acid reflux and heartburn, specifically proton pump inhibitors when used long-term. While the evidence is mixed and still evolving, some studies have suggested a potential association between long-term use and increased dementia risk. The theory is that prolonged suppression of stomach acid may interfere with nutrient absorption, particularly vitamin B12 and magnesium, both of which are crucial for neurological function. A deficiency in B12 alone can cause memory impairment and confusion that mimics dementia. Similarly, certain cholesterol-lowering medications have been discussed in relation to memory complaints. While most large studies suggest statins are generally safe and may even protect against vascular dementia, some individuals report short-term memory issues after starting them. This doesn't mean they should be stopped abruptly, especially if they are preventing heart attack or stroke, but it does mean that any new cognitive symptoms should be discussed with a healthcare provider rather than dismissed. Let's not forget opioid pain medications. These drugs act directly on the brain and can cause sedation, confusion, and slowed thinking. In older adults, the effects are amplified. Long-term opioid use has been associated with cognitive impairment, especially when combined with other sedating medications. Chronic pain needs management, but the method matters greatly. At this point, you might be feeling concerned or even overwhelmed. That's understandable. But here is the most important message of today's discussion: never stop a medication suddenly without consulting your healthcare provider. The goal is not fear. The goal is awareness. Many of these medications are appropriate and necessary in certain situations. The problem arises with long-term use, high doses, or multiple overlapping prescriptions without regular review. So, what can you do right now to protect your brain? First, request a comprehensive medication review. Bring every prescription, over-the-counter drug, and supplement to your next appointment. Ask your doctor or pharmacist specifically about cognitive side effects and anticholinergic burden. Second, avoid self-medicating with over-the-counter sleep aids or allergy pills without checking labels carefully. Third, explore non-drug alternatives when possible. For sleep, this might include improved sleep hygiene, light exposure during the day, and consistent bedtime routines. For anxiety, cognitive behavioral therapy and relaxation techniques can be extremely effective. For bladder issues, pelvic floor therapy may reduce symptoms without medication. Another key strategy is monitoring vitamin levels, especially B12, vitamin D, and magnesium. Correcting deficiencies can dramatically improve cognitive clarity. Staying physically active, socially engaged, and mentally stimulated also strengthens what we call cognitive reserve, the brain's ability to compensate for stressors. Polypharmacy, which means taking multiple medications at once, is extremely common in adults over 65. The more medications you take, the higher the risk of interactions and side effects. Regular de-prescribing, carefully reducing or stopping unnecessary medications under medical supervision, has become a growing focus in geriatric medicine. Studies show that when done safely, de-prescribing can improve alertness, balance, and overall quality of life. It's also important to distinguish between reversible cognitive impairment and progressive dementia. Some medication-related memory problems improve once the offending drug is reduced or discontinued. That's why early recognition matters so much. If you or a loved one notices sudden confusion, memory lapses, or personality changes after starting a new medication, do not ignore it. Report it immediately. Let's take a moment to talk about communication. Many seniors see multiple specialists: cardiologists, urologists, psychiatrists, primary care physicians. Each may prescribe medications without full awareness of what the others have prescribed. Keeping an updated medication list and sharing it at every appointment can prevent dangerous overlaps. Family members also play a crucial role. If you are caring for an older parent, gently ask about their medications. Offer to attend appointments. Sometimes seniors hesitate to question doctors, but asking informed questions is not disrespectful. It is proactive healthcare. Now, I want to emphasize something hopeful. Dementia risk is influenced by many factors. Some we cannot change, like age and genetics, but many we can influence. Medication management is one of the most controllable factors. By staying informed, asking questions, and reviewing prescriptions regularly, you significantly reduce unnecessary risk. Brain health is not just about crossword puzzles and supplements. It's also about reducing avoidable stresses on the brain. Every sedating drug, every unnecessary anticholinergic, every overlapping prescription adds weight. Removing even one inappropriate medication can make a noticeable difference in mental sharpness. If you remember nothing else from today's discussion, remember this: common does not mean harmless, and long-term does not always mean safe. The aging brain is more sensitive to medications, and what worked at 45 may not be appropriate at 70. To summarize, certain anticholinergic drugs, long-term benzodiazepines, some sleep medications, older antidepressants, bladder control drugs, antipsychotics, prolonged proton pump inhibitor use, opioids, and overlapping sedating prescriptions may contribute to cognitive decline in seniors. The key is not panic, but proactive review and thoughtful management. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what topic you want to see next. Your brain health matters, and small changes today can protect your clarity for years to come.